I want to just take 4 or 5 minutes and think with you about where COVID is leaving us first of all, where COVID is leaving our communities in terms of mental health and well-being, and where it's leaving our churches and what we can do about that. If any of you have got the Northern Ireland COVID app, and if you open it, on it, about halfway down on the right-hand side, is the COVID Wellbeing Northern Ireland Hub. And if you press that on your phone, it'll come up with a whole range of services and connections that will help. And it covers a whole range of issues. I took a look at it today to make sure that it hadn't changed. Here's the issues that app says our communities are facing. Increased alcohol, drug and gambling usage and the challenges that come with that. Anger management and the challenges that come with that. Anxiety, bereavement, depression, loneliness and isolation, long-term conditions and managing them as we come out of lockdown, and where we've been left or where community members have been left because of a lack of treatment or a fear of treatment or anything else. Money and financial insecurity and job insecurity. A challenge around physical activity, a challenge around relationships and relationships that have broken down or relationships that have been strained by lockdown. The absence of rest and the impact of working from home and having no space to have a workspace and a rest space, and the line between the two, which has massive impact on people that are having to deal with that. Rural support in Northern Ireland around mental health is particularly challenging, and what that means, and I don't mean by rural simply in the middle of the country, I mean rural towns, county towns. Some of the county towns in Northern Ireland and on the island of Ireland would be considered semi-rural, and what that looks like. And of course, domestic abuse. There's been a 13% increase in reports of domestic abuse in 6 months. 18,796 incidents. That's 51 a day. One every 25 minutes. That has a massive impact. And I guess what we have to do is work out what we're going to do. Psych referrals up by 43% in Northern Ireland, and no added resources yet to meet that. And with an executive that is still arguing about funding, and with services that are still disparate and disconnected, the church has a vital role to play in all of that, I think. And I think what I love about Kintsugi Hope, and what I love about the vision that Patrick and Diane have, and what Sarah has bought into, is that Kintsugi is being humble enough to say we aren't the only answer, and we're not going to try and overstep what we can do. We're simply going to try and do what we can. Back in 2017, across the UK, there were, in 2016, 2017 and 2018, there were 3 reports that were published, 2 by Theos and 1 by a guy that used to work for Theos who was involved in the reports, called Ben Ryan, around the provision of mental health support and help through local churches. And what it identified was that it was a very disparate picture. It was a very increasing picture, but there wasn't a single sense of commonality across the churches. One programme that people could go to. I don't know, Patrick and Diane or Sarah, if you've seen that research, but as I was looking at it preparing for tonight, it struck me that actually Kintsugi Hope is an answer to that in some ways. It is a joined up attempt to bring well-being conversations across local churches and to use what they have very well. At the heart of a church's response is what Jesus would do. And we have a theological question that we need to wrestle with. We have a theological question around responsibility, a theological question around redemption, and a theological question around reconciliation. When some people live with mental illness, when they have a mental illness, or they have a personality disorder, more importantly, what responsibility do they have or not have if that is not necessarily a treatable condition? Kintsugi Hope doesn't try to fix that. Instead, it simply walks with people and seeks to help them as best it can, and acknowledges that it isn't the answer that is rolled up in everything. And it's not simplistic. It creates spaces of vulnerability and honesty. These are questions, by the way, that psych health professionals and theologians have been wrestling with for 5 or 6 years. What do we do about responsibility? What do we do about redemption? What do we do about reconciliation? I think Kintsugi Hope into the question of redemption brings a space where people can be, where they can be in relation with one another, where they can be connected to one another, where they can hear one another's story, and where they can discover hope. And I think in terms of reconciliation, Kintsugi Hope Wellbeing groups help people to find an inner reconciliation, a communal reconciliation, and a holistic divine reconciliation, which is quite unique. Now, where does that all leave groups in Northern Ireland? What would the church's challenge be in Northern Ireland as we move forward and as Kintsugi hopefully gets established and grows here? I think as we come out of lockdown, local churches are going to need to be spaces where people can be. I think we're going to need to wrestle with lament and rediscover Psalm 88, Psalm 42, Psalm 43. We're already talking as a church about how we can create spaces for a communal mourning. How do we create a moment of, I'm sure many of you were involved in the National Day of Reflection on Tuesday. We certainly were, and had a lot going on around that. Think about all the people that you have been involved with who have lost loved ones across this pandemic. I have buried 42 people. And in the last 6 weeks, I've buried somebody every week. Today, at 2 o'clock, I buried somebody else. At the beginning of this pandemic, I buried a friend from school. His mum contracted COVID and died. And 7 days later, his dad contracted COVID and died. And he lives in Australia and wasn't able to get back. And I had to construct a service that he could watch in Australia, his sister could watch here. But all of those people, and I know all their names, I've got them written down, I pray for their families. And each one matters. How do we create a space for them and for their families? Let's assume that every family has half a dozen people connected, and that's a very low estimate, right? Then if you take 2,000 and multiply that by half a dozen, you're already at 12,000 people. 2,000 families is likely to be more like 20 or 30,000 people who will need help to come to terms with loss. Alongside that, there are many Christians whose mental health will have been affected. Alongside all of these stories of people saying, I can't wait to exit lockdown, I can't wait to get back into a meeting, I can't wait to get back to a building, I could give you twice as many stories of people who say, I'm actually quite nervous about it. I'm just afraid of saying it in case somebody judges me. I'm not sure that I'm going to be able to rush back into a gathering. I feel unsafe. We can't just tell them to get over it. We've got to create safe places for churches and for Christians to think about their faith and some of the sacred cows that have been pulled down by this pandemic for them too. And then how do we help our communities just by being the hands and feet of Jesus? I think one of the things that, so here are some things that I have questions that I leave you with before we go on. Churches, as we exit lockdown, have to ask, who are we? And who are we here for? How are we going to connect with, Patrick uses a phrase often, the least, the last and the lost? How are we going to connect with those who feel most vulnerable? The missiologist Leslie Newbigin, back in the 1960s, talked about local churches being spires of hope. What would it look like for Dundonald Elam, for Carryduff, for Carrick, for the Church of the Nazarene, for every church here, to be a spire of hope in its community? To be a community that says, this isn't the end of your story. We can't tell it all for you, but we can find a space for you to hear and experience hope. I think that's a really vital question for us. Edwin Friedman, the psychologist back in the 1960s, talks about a lot, came up with the idea of being a non-anxious presence. Mark Comer did not come up with that idea. He borrowed it from Edwin Friedman. Edwin Friedman's work on being a non-anxious presence is really important. How can I be a non-anxious presence to my family? But how can the church, a local church, be a non-anxious presence to its community? Create spaces for people just to find hope and to be. And lastly, I have a question that asks, the 19th century philanthropist and somewhat theologian, really he was an art curator, John Ruskin, after whom East Anglia University is named, talks about the fact that every human being, this moves me, this image, every human being has a tear in their soul. And when you really love somebody, when you really want to help somebody, you find a way of helping them identify the tear in their soul. And you don't try to mend it. You just acknowledge it. And if you're a Christian, you let God do something with that. There's a tear in my soul because all the statistics that you've heard talking about tonight. Back in 2014, North Belfast is the biggest rate of suicide amongst young men in the world. Johnny McKee is on this call. He knows that better than anybody. He works tirelessly to try and do something about it. One of the best suicide intervention charities and support groups in the world and in the UK is the Lighthouse that works out of the top of Duncan Gardens. They were working with clergy years before anybody was talking about mental health for clergy, for example, in a programme called Flourish. But back in 2014, my 25-year-old beautiful nephew, Jonathan, in North Belfast, hanged himself. He was my sister's only son. And a nuclear bomb devastated in our family. It just exploded. 20 weeks to the day after he had killed himself, my brother-in-law, Jonathan's dad, killed himself because he couldn't live with the loss. The anniversary of his death is Good Friday. 6 months after that, my brother, a leading journalist in Northern Ireland, drank himself to death. His liver exploded and he died within 6 hours. 4 months after that, my mother, heartbroken and unable to cope with the grief, died. So when it comes to mental health and comes to being vulnerable, I don't know. The terror in my soul is grief. The terror in my soul is sadness, and I'm not ashamed of it, and I'm not afraid of it, and I want to name it and say that in that terror I've encountered God's grace and God's beauty, and I've learned to see the world in a different colour, with full of hope, full of possibility. And there are hundreds of thousands of people in Northern Ireland who don't need us to fix them. They just need us to love them. How's the church going to do that? Thanks.